I'm on first, huh?
Yeah, sorry. I went alphabetical.
Again, my name is Bob Freeman. I am the CEO of SenCal Health, and we administer the Medi-Cal program in both Santa Barbara and San Luis Obispo counties. It's interesting because we've experienced a significant amount of growth in the last 2 years. We now insure 1 in 4 people in Santa Barbara County are on Medi-Cal. And so the sheer number of people low-income people we take care of has grown significantly. So we're very interested in this discussion because it affects a lot of our population, or a lot of our population is, in the center of it. I've lived in Santa Barbara 23 years, 26 if you count college before. I don't want to wait, but what was the next thing? How I would like Santa Barbara?
What a healthy Santa Barbara means to you, and what it looks like, what it means.
Well, I think a healthy Santa Barbara is going to be, which I think a lot of this community already has, is a real sense of community where people like us can come together, the hospitals and the police department, the fire department, and health plans, whatever, to address community problems and work together. I'm not sure that exists in a whole lot of other areas like Los Angeles or San Francisco or something of these big areas where you just don't have that sense of community. Yeah. So I think that's an important thing. And I also think it's important that when you look at, like the homeless population and all that, I mean, this community can't solve the global reasons for it, but it'd be nice if we can come up with ways to treat that population in a compassionate way, but also ensure that they're kind of doing the other side, which is, okay, let's give you someplace you can get off the street and not, bothering the people that come here and are the bread and butter of the area. So I think that's my questions.
Thank you.
Hey, excuse me. Good morning, everyone. I'm John Polanski. I'm Director of Housing Development with the Housing Authority of the County of Santa Barbara. I've been with the Housing Authority, it was 20 years in June. I've been in Santa Barbara 23 years also escaped from LA. Worked in actually downtown LA for a number of years. Because what we do is the bricks and mortar part of affordable housing, I think connecting the health services and other support services that our residents need to be successful and to stay housed, particularly those that are coming out of homelessness, is one of the important things that the community is starting to do, and I think doing a very good job of. One of the things that we found is that, and I'm sure our police officers can attest, a number of the people experiencing homelessness don't trust authority figures. And as much as, and Skip is my colleague at the City Housing Authority, we don't try to be authority figures. We're still seen as authority figures as our police officers and many others. So what we found is that providing particularly health services, both preventive and to take care of needs, as much as possible at the sites where the individuals are now living, because coming out of homelessness into affordable housing is a big step. It takes a tremendous amount of focus on the individual's part. I'll just use one really quick example. We opened Pescadero Lofts out in Isla Vista nearly 2 years ago. It's 32 units for people coming out of homelessness with a connection to Isla Vista. Our average time in homelessness was 14 years. We had 9 veterans, homeless veterans, out of the 32. One veteran who had been homeless since returning from Vietnam had actually been on the streets for over 4 decades, waiting for something that they felt comfortable going into. And so what has been really successful, and I'll give a shout out to public health, is we have a public health nurse that comes on site and provides some flu shots, provides some preventive care, more importantly, has a few office hours. So the individuals that we can't get to go to the clinic no matter what they're experiencing, the fact that they just have to go down the elevator and at the same place that they're receiving their ESL, their computer labs, AA meetings, and the like, they're able to get some preventive and some diagnostic healthcare is really good. And I think that is what a healthy Santa Barbara would look like, focusing on the most vulnerable populations as well as those of us that don't have a problem going into the clinic or the hospital.
Okay, thank you.
Martin Johnson with Santa Barbara County Fire. Just started my 30th year on the department, so it's been a great run here. You know, the fire department deals mainly on that emergency side, typically a very short window of dealing with folks, and it's, you know, one of the fascinating things about this job and is you often are called into people's lives in the most surreal, traumatic, private moments, whether it is a elderly person who's lived a wonderful life who is passing on, to the tragic youth who just has their life ended for some reason. And that role that we play out in the community of service and really being that public servant for the community transcends everyone from, you know, the most wealthy of our community all the way down to the least. And so that's been a privilege of mine over the years. But I really think that in the issues of homelessness and dealing with those folks in the greatest need out there, one of the things that we see, and having worked in Isla Vista for many years, is you'll get those calls to the park where it's an unconscious subject and it's Sam. And we've been on Sam, you know, 12 times in the last 4 months. And, you know, there's where there's alcohol or drugs or what have you, it's a repetitive thing. And so seeing programs that can help Sam get off the street in a way that gets him the help he may need is certainly something that we appreciate greatly because of the impacts on the system that generates. So, but the healthy part of Santa Barbara, I mean, we have such a great collaborative relationship with EMSA, the police department in our community, AMR, the ambulance response company in our community, and hopefully most people think the emergency system is working well. We think it is, and but I certainly would love to have more collaboration with all of you from a holistic standpoint from the beginning all the way to the end. So, thanks for having me.
Thank you. You know, one of the things in your story, Sam, you know, the listening groups that we did started actually internally with Cottage Health and their employees, and which were revealing on a lot of different levels. But one of the things that we heard was that sort of same thing, the sort of like the idea that if you see the same people again and again and again, how troubling that is, you know, and people are in these kinds of jobs to serve and to make a difference. And when you see this sort of like, you know, revolving door, there's a recognition that something different has to happen. So, thank you.
Hi, good morning. Thank you for the invitation to this. My name is John Eaglesham. I'm the director of the Emergency Medical Services Agency for the County of Santa Barbara. We sit within the Public Health Department. I've been here about 40 years, came to college here, worked at Santa Barbara Cottage Hospital. I loved medical, I loved the hospital environment. Cottage was a great place to work, still is apparently. I saw the paramedics come and go, and I worked there when the new young ER docs were coming out, Dr. Thomas, Dr. Gayu, Dr. Lambert, all those guys who were fresh young ER docs. And I saw the paramedics come in and out, sweating, doing CPR, trying to get that IV started. And boy, I left college and went right to LA to go through the paramedic program so I could do that. And I've been involved in this for the whole time, one way or the other. I'm interested, particularly Santa Barbara, we've pushed a lot about a healthy community, healthy environment. I think we've done a pretty good job. People are trying to lose weight. I think there's a lot of recognition to that. Cardiac health, we've watched a lot of that. We sponsor CPR on the farmers markets. I think Tuesday night is farmers market, is it? So we do free CPR training, and we're pushing hands-only CPR. So no mouth to mouth, hands only, hard and fast CPR. His engines will be on scene within 7 minutes 90% of the time. The ambulance will be on scene within 7 minutes 59 seconds 90% of the time. You'll only have to do hard and fast CPR for so long. We're looking at certain survival rates that are witnessed, ventricular fibrillation, cardiac arrests. It's kind of a category. but we're saving greater than 50% of those people because of hard and fast CPR, citizen CPR, and then our first responders who have struggled over the years to choreograph a cardiac arrest so that it's a smooth running operation. And in the past, it was kind of like any type of an emergency where the tension is high, critical moments are passing, and people would kind of be a little excited about what to do next. We spent a lot of time with our help with the law enforcement, fire, and the ambulance company and the hospitals to choreograph that. So the paramedic is at the head of the patient, the EMTs are doing CPR on either side. There's a captain who is logging information, and everything is going smoothly, and we're saving lives. So it's really important we continue with our CPR and our hard and fast hands-only CPR. People were afraid of the mouth-to-mouth part. They couldn't quite handle the complexity of it. So we're saying just hands-only CPR. The team will be on scene within very few minutes, and it's working real well. So I'm pretty optimistic about the way we're working with our hospitals, with our ST elevation, myocardial infarction, another kind of a heart attack, our stroke care, and our cardiac arrest survival. So we're doing a great job, and it's only up from there.
And what does a healthy Santa Barbara look like for you?
A good environment, healthy people, and options for everything. I think that everybody's at the table here, for housing, for reducing recidivism, and I guess increase awareness for healthy choices.
Great, thank you.
Good morning, Officer Craig Burley with the Santa Barbara Police Department. My specialty assignment at the moment is restorative policing. First of all, thank you for breakfast this morning, it was wonderful. Been doing the restorative policing for about 6 years, worked for the city of Santa Barbara for 22 years. So every day I get the honor to help the most vulnerable population in our city, which is the homeless civilians and also the veterans. So I split my time 50-50 with 2 courts. Both courts are voluntary, so it's not court-ordered or any probation or parole. Basically, my whole career has been working with the homeless community, so I know 90% of the homeless, the $1 Million Murrays, and with both courts, we offer a program. It's anywhere from 6 months to a year, and my clients are the embedded homeless that live under the bridges, on the beaches. It's a win-win situation for the client if we can improve their quality of life and then help them up. And then it's a win-win situation for all first responders. That's the fire department, and we wake up at 3 o'clock in the morning because someone's having chest pains, AMR, and also Cottage Hospital. So we work with your Monday morning meetings with the $1 Million Murrays. So we're pretty embedded with your case managers, because eventually, once they get medically stabilized, they have to leave Cottage Hospital. So we work already pretty well with Cottage Hospital, trying to solve the chronically homeless in the city of Santa Barbara. Healthy Santa Barbara is continue working with Cottage, and also we work special cases with Doctors Without Walls. So it's basically, it's a collaborative. Not one agency or entity can work with the homeless. It's all about networking and building those relationships over those 6 years to help the most vulnerable population, because it could be our brothers, sisters, mothers, and fathers. We're all a paycheck away, and usually it's resulting in a injury or dual diagnosis, mentally ill, alcohol, drug abuse. Healthy Santa Barbara, I know Cottage Hospital stepped up working with PATH. They have medical beds just like us. We have police beds, which are for the middle of the night where a female is a survivor of a heinous sex crime. Instead of them just wandering the streets, our police department, our city, has got funded for many, many years to put that vulnerable, and it doesn't have to be a female, it also can be a male survivor, into a safe environment, which is PATH. My dreams and my wishes is to extend that, working with Cottage, getting those medical type beds available. Salvation Army, they're huge with restorative policing. We work really close with PATH, Salvation Army, and obviously the rescue mission. And then the Folding Hotel, working with the city housing. That's pretty much a cherry patch for us. We, metaphorically, we have them from anywhere from 6 months to a year, but we have the lifers of the $1 million Murray, because if we don't keep case managing them, guess what? It comes back to all first responders. So my goal is to get a veterans bed paid for at the Folding Hotel and a medical bed, because it's pretty much cheaper to keep someone at the Folding Hotel instead of the ER at the hospital.
Thank you.
Thank you.
Should we introduce ourselves quickly?
Go ahead.
I'm Maddie Fry with Cottage Health, Director of Population Health Evaluation. And just briefly, evaluation is kind of getting people to ask what would success look like and how are we measuring it. I think often it gets kind of a bad rap, but that's how we are operationalizing it here at Population Health. So not an easy task if you think about the folks that we're trying to get around the table to have kind of shared measurement toward a common goal. And this is our year of listening, our year of data collection. So after 2016, we'll collect all these different kind of data sources and information from people like yourselves, and we'll try and move forward informed from these various listening tours and from the work that we're doing in the community that Bob mentioned. So thank you for joining us.
And I'm Allison Conwell with Gail Will, and we are supporting Population Health in this listening tour and with their upcoming Population Health Summit in April.
I'm Monica Ray with Population Health at Cottage Health, and I work with community benefit in our community outreach programs, which includes our grants and community.
I'm Sergeant Riley Garwood with the Santa Barbara Police Department. I've been with the department for 25 years. In that time, I've had a lot of experience policing the homeless community and also dealing with community issues and community-oriented policing and problem-solving issues. A healthy Santa Barbara, to me, is a community where people express a lot of satisfaction in their quality of life. We are very fortunate to live in a community where I realize that most people are not concerned about being victims of violent crime every time they step out of their front door every morning. There's a lot of cities that are like that, but ours is not one of them. The things that people in Santa Barbara complain about on a daily basis to the police department, however, are often lower level crimes or issues that are not actually even criminal, but they're all things that impact in some manner their quality of life and how they perceive whether or not they enjoy living here or having a business here or coming and visiting here. So that's really, I think, for us in our line of work, a good barometer of whether or not this community is healthy or not. One of the things that I've found in my experience is that, well, as far as quality of life goes, the things that people complain about the most are traffic-related issues, because our streets here were designed a century ago, and they're not made to accommodate the volume of traffic that we have these days. And then also, in some manner, the impacts of homelessness as a result of inappropriate behaviors by people in the homeless population or other aspects, some of which are the way services are delivered to people. So those are the big things that people complain about on a daily basis to the police department. One of the things that I've come to realize is that in dealing with many of these issues, which the ones that we keep coming back to over and over again, like dealing with the service-resistant alcoholics or mentally ill that we see on State Street and other places, those really challenging cases, our greatest chance of success comes when we collaborate and utilize a multidisciplinary approach to dealing with the situation. In government, we have a problem in that we're very accustomed to kind of triaging issues to a particular department. So an issue might come to the forefront, it might come to the attention of folks at City Hall or my police department staff, or something. You know, people might say, okay, that's an issue for Public Works. You guys handle that. Or that's a fire department issue. That's a police department issue. Parks and Rec, we deal with that. And folks within that department, you know, will devote their resources to it. And, you know, they might have some success, but often in the most difficult cases, it will be very challenging. What I found is that when we come together collaboratively, both folks within the city and other service providers in the community, and when we come up with an action plan, all of our resources, we're all on the same page. It doesn't matter who contacts that individual or deals with that issue at a particular time. We're all on the same page with regard to what we want mutually to accomplish. And that really increases our chance of success tremendously. Another thing that I've come to find is that what is often overlooked is when it comes to delivering services to like the homeless population, one thing that's often overlooked are the unintended consequences, the negative consequences of whatever action that we take. And I can think of a couple of examples. For example, you have different groups in the community who like to feed the homeless, and they'll come to our parks and drop off a lot of food, hand it out, and then leave, and without taking much consideration for the fact that there's now a lot of trash in the park that needs to be cleaned up, and now a large congregation of people that may be remaining there and engaging in some inappropriate behavior, like drinking, other things that are impacting other people's quality of life. Another example that I think underscores that is, I remember back in the 90s, mid-90s, prior to Casa Esperanza, the PASS shelter being built. And you would see some of these clients walking all across town for services. In the morning, they might be at the Salvation Army. Then they walk several blocks to Catholic Charities, but to do something else. And then walk over by the Rescue Mission for something else. And you know, it was really a very ineffective way to deliver services to these people. But one of the things that did was it spread out the negative consequences of the homelessness in our community over a large geographic area. So the impact of that was kind of spread out. When Casa Esperanza was built, we had now a very good centralization of services. And so service delivery was improved significantly. But what wasn't given consideration in my observation was the fact that now the negative impacts of homelessness were concentrated in one neighborhood that struggled for well over a decade dealing with those issues. And it was really unfair to those merchants and those people living around there to have to deal with those. So I think when it comes to service delivery, that's something that's often overlooked, consequences like that, and that it's best if we do try to be cognizant of those things, because some of those decisions impact the things that we have to do for years and years and years until they ultimately change. If I was king, what I would have done, I would have maybe created multiple medium-sized facilities, maybe one on the west side, one on the east side, one on the north end. That would have been a little more difficult in delivering services, but again, it would have been a better balance with regard to service delivery and impact to the community.
Thanks.
I'm Jerry Estrada, General Manager, Santa Barbara MTD. Lifelong resident, born in Cottage Hospital, raised in Carpinteria. Been with the district for 27 years. Do a lot of volunteer organizations as well. First of all, I'd like to kind of acknowledge the work Restorative Policing is doing. And Riley mentioned, I get a lot of updates once a month on the work that they do with the homeless especially. And it's fantastic to me, the outreach you're doing. I really commend you for that. From a transportation perspective, along with Lynn has a great segue, actually service provision, I think is critical. When you look at where you're going to put a new clinic or new services, please take a look at the public transit system. and what the frequencies are for those corridors. For example, when the Sansom Clinic was built on Foothill, we made a modification to one of our routes, a line 3 that serves Cottage Hospital, to extend up to the new clinic so that we're able to serve it better, more efficiently, because it would have been a challenge for, if we hadn't made that change. So that kind of coordination going forward, I think, is critical. So whatever efforts are made in the future, and whatever plans you have for where you're going to provide those services, whatever they may be, by all means take a look at that. We serve quite a diverse group, the entire community, from children to seniors to those with special needs. And when you look at, for example, about 30% of our ridership is City College and UCSB students, but we also serve K through 12 to the schools. We also serve the seniors, and Easy Lift does a fantastic job of supplementing our work for those seniors who are unable to utilize public transit service. Together, I think there's some really good options out there for people, as long as those facilities are built in the right neighborhoods, that sort of thing. So that's something from the transit perspective as a professional that I would like to mention as a priority. Also, what personally speaking, as a carpenter and as someone who grew up here, working with youth. I mean, the work of some of the nonprofits like the Boys and Girls Club. I served on their board for many years. Making sure that youngsters get fed. I coached, and I saw a lot of kids in this community who parents are working 6-7 days a week, and the kids are on their own. And unfortunately, sometimes you probably run across them as they get older. They don't have that, that structure at home, and sometimes they're not even getting 3 meals a day. And organizations like the Boys and Girls Club, and I believe Girls Inc. as well, have stepped up and really helped in that regard, as have the schools. So any support they can get to help young people as well. I know we get focused on homeless, which is very important. I acknowledge the work that's been done, but there's a lot of young people in our community that could use some help too, and I think they're getting it, and the more of those services we can provide, the better as well.
My name is Jessica Kediente. I am the library director for the Santa Barbara Public Library System. That is from Solvang to Carpinteria, but I'll focus on the Central Library today in downtown. We, of course, see everyone coming through our doors. We have the people dealing with food scarcity. This year, we had lunch at the library to help facilitate children in our community that really only eat at school. We have the seniors who spend all of their money on their prescriptions or just to stay alive and rely upon the library for their recreational and educational needs. We have the homeless population who use our library for everything from powering their cell phones to sanctuary from the rain. So we really see cradle to grave problems at the library, and it is a mission creep for us. Our main pillar is education. We want to work with the schools and to really enhance the lives of our community. And so that's kind of what we call a first world problem, because when we have people coming through our doors that don't have basic hygiene, aren't able to eat, focusing on the infant that needs to acclimate to the world and concentrating on the parents and teaching them that they need to start reading to their children. That's the next phase of fixing things. So I think a healthy Santa Barbara. Now I should say I've only been in Santa Barbara a year. I feel like an alien here. But I am from Flagstaff, Arizona. But prior to this, I spent 2.5 years in Lompoc, and so I have fresh eyes to Santa Barbara, and first of all, I'm so impressed with all of the services that are here. So what I find at the library, especially, people don't know they exist. Agencies tend to work in a vacuum, and as the library, we really focus on being the hub, and we connect people to where they need to be. So, healthy Santa Barbara, I would like to be in Santa Barbara, we could focus on those first world problems like literacy and the well-being of people, and that the poverty and the just trying to find where you're going to eat, those problems don't exist. And I think that as a new person, I am very surprised at the height of those problems here. And I think most people, I know that when I say I'm the Santa Barbara Public Library Director, I get a lot of, gosh, do they even need a library there? All those millionaires. And so people don't quite get that the challenges we face, so.
Skip Szymanski with the Housing Authority, City of Santa Barbara. I've been with the Housing Authority about 24 years. I've been in Santa Barbara about 40 years. We provide housing supposedly for low-income individuals, but we have broadened our scope throughout the years in that we are doing some specialized housing. I did want to make an additional comment. I'm with the Housing Authority City of Santa Barbara, but I also sit on the board for the county's community health centers. So it's very interesting. Thank you, Cottage Hospital, for hosting this, because I sit on a board that does something similar for the low individuals, and it's very interesting. But back to the Housing Authority, we serve supposedly the low-income individuals, but throughout the years we have collaborated with the city. We provide downtown worker housing for lower-income individuals. We provide specialty housing for homeless. We have El Carrillo, Artisan Court, and Bradley. We serve youth aging out of foster care. We have some units dedicated at Artisan Court for youth aging out of foster care. Probably one of the biggest populations that we do serve are seniors. So we see people aging through to the end of their lives, and special needs. One of the biggest issues is that even though we're a housing authority and the government was set up, housing authorities were set up to provide housing, it's not really a successful model unless there's services with it. The homeless people, the seniors, the special needs, we see a lot of the people coming in out of homelessness, and if they don't have the supportive services to stabilize them, we're out there filling out the paperwork to get an eviction. That is the last thing that we want to see, is to evict someone because they did not fit in the environment. So if you take an apartment and a private landlord, that's it. You have a contract. And if the people break that contract, they're out. We do everything to avoid those kind of situations. We want to see people get into housing and get stabilized. I have a saying that it's like a ladder of life, that if you're homeless and you get housed, you've stepped up the ladder. If you're homeless and you've gotten housed and then you get services to where you can get a job or improve yourself, you're moving up that ladder higher. To me, a healthy Santa Barbara would, socially, social Santa Barbara, would be where individuals never go below the rung that they've achieved in a particular day. The stories are very sad. We work with the hospitals and special services, county mental health, and all of these special needs people that we see need services. And when we hear, well, this person went in, they're looking for housing for them, they're in the hospital, they're going to get released, what are we going to do with them? And we can't get together and say, well, we can't put them in an apartment because they're not stable enough to live in that apartment environment. So the other housing providers that are providing for those with special needs, they just don't have enough units, enough rooms, and the services aren't always there for them. So for me, to seeing the crossover of the services to see the groups coming together to say, we have this individual, what path do we walk them through so that they can get stable, so they can get up on the next rung of the ladder. We're also looking at serving a higher income population. The people that work for all of us, where are they coming from? They're coming from out of town because they can't afford to live in Santa Barbara. That's a huge problem that we see. We would like to be able to expand the middle income housing. I think that would do a lot for Santa Barbara's, to stabilize Santa Barbara, make it a more healthy environment. But I would say the biggest issue to help Santa Barbara be healthy is to come together as collaborators to ensure that those in most need have all the services that they need, not just the housing, but the mental services and drug addiction, the prevention and so on.